Hey guys, Nurse Alyssa here. Welcome back to my channel. Today we're going to be talking about Exu-dry anti-shear cover dressing. But first, if you could smash that subscribe button, it would be greatly appreciated as it does help me on my channel. So let's get started. So Exu-dry is just a sterile, absorbent, anti-shear dressing. It's just so for wounds in areas, say the coccyx or an arm that's being rubbed a lot, places that are being rubbed a lot, and you want some protection on that skin, so they're not having like skin tears, especially when you're trying to heal the wound in that area already. We don't want to make it even worse. So this is an anti-shear dressing. For indications for use, so we're going to use this on wounds with moderate to large amounts of exudates. We can also use this for painful wounds, graft, and donor sites. And there's really no precautions or contraindications noted for this product. Application of this dressing, we're going to make sure that we cleanse the wound and peri-wound with normal saline and then dry the peri-wound tissue. We're going to choose an appropriate size dressing. Now this is important because we cannot cut this dressing. This dressing is not to be cut, so you apply the whole dressing on, secure it in place with cling, tape, or a mesh stocking to remove this. So it should just peel off nicely. If it doesn't, we can soak it with sterile saline or remove it in the shower. So just take whatever is actually holding it on, whether the tape, cling, mesh, take that off, and just let the water run over top of it and it will become really heavy, and just like gently remove. It can also be saturated in a bathtub. That's perfectly fine too. So the frequency of dressing change is going to depend on the amount of exudate coming out from the wound, but it can stay in place for up to 7 days. And the expected outcome of this dressing is that we are managing the exudate and we have no peri-wound maceration. That's all I have for this video. I will catch you in my next one.